Hello guys, welcome back to Medico Days. So in this video, I'll be discussing about the pharmacology PYQs. But before moving on to the details of this video, I am happy to inform you all that our book is ready and it is available at a nominal price. And if at all you guys are interested, you can text me. It has taken a lot of effort. It has taken around 100 days for me to compile that book, which contains all the PYQs of NEETPG with small explanation, and it has taken around 100 days to compile all those 7 years question papers, guys. So yes, if you are interested, please do text me and it will be surely of help for you in the last minute revision. In the last 1 week you can, or in the last 2 to 3 days itself, you can complete the book by just having a glance through all the pages of the PDF. It'll be easier to learn. But if you are someone who wants to learn from the video, yes, then the video also we are uploading and the content is available as free in the video, but it takes a longer time for revision. That's why I suggest about the PDF. But guys, yeah, anyways, I'm moving on to the details of this video. So first question from 2018 PYQs: a colonoscopy of an elderly patient revealed brownish pigmented lesions as shown below. He is admitted due to chronic laxative abuse. Which laxative is most likely to cause this condition? So answer is senna, because the brownish moire pattern seen on a colonoscopy is diagnosis of melanosis coli, and it is caused by chronic use of anthraquinone laxatives like senna and cascara. Bisacodyl is also implicated. Next question: a patient who is on treatment for angina presents to you with erectile dysfunction. You decide against prescribing sildenafil because the patient is being treated with, answer is nitrates, because sildenafil is a phosphodiesterase 5 inhibitor and nitrates also. So these two, they cause both of their effects, they cause an increase in CGMP leading to uninhibited vasodilation and severe hypotension. So this combination is contraindicated. An example of a bacteriostatic drug is answer linezolid. So the actions are not same, like sildenafil is a phosphodiesterase 5 inhibitor, nitrate is something else, but their final action is like they both increase the cyclic GMP. So that is why it is used in combination is contraindicated. Next, an example of a bacteriostatic drug is answer linezolid. It is a bacteriostatic agent. It inhibits the protein synthesis via 50S ribosomal subunit. Next question: the antiviral drug having dual antiviral activity against HIV and HBV is, answer is emtricitabine. So these kind of questions are direct, like you just have to learn it. Pharma has a lot of questions which you will have to learn like that itself. So emtricitabine is a nucleoside reverse transcriptase inhibitor, NRTI. It is active against HIV 1, 2 and HBV. The replacement dose for hydrocortisone for chronic adrenal insufficiency is, so this is an important question. Please, if you don't know, please learn it. It's a direct question, one word. So it is 20. That is 20 milligram per day. The range is 15 to 25 milligram per day. Next, which of the following is the drug of choice for scrub typhus? Answer is doxycycline. It's a first line drug for scrub typhus, which is caused by Orientia Sutsugamushi. And yes, so please learn about it. This scrub typhus is a very important question. Please, the chiggers and everything, please learn more about it. Next, which of the following other rickettsial infections also, please go through them. Even from microbiology point of view and medicine point of view, those infections are important. Which of the following drugs is associated with QT prolongation? All the drugs which cause QT prolongation, please learn their names, very, very important. So here the answer is quinidine. It is a class 1A antiarrhythmic. All this class 1A and all the classes, please go through them, very, very important. And how is the mechanism of action, all this is very, very important. So quinidine, which is a class 1A antiarrhythmic, it blocks the potassium channels and it causes QT prolongation and torsity pointus. Lignocaine is class 1B. And next question: sacubitril is a new drug approved for chronic heart failure. Mechanism of action of sacubitril is, answer, neutral endopeptidase inhibitor. So sacubitril inhibits the neprilysin, increasing the natriuretic peptides, that is the ANP and BNP, and it reduces the BP. Next question: coagulation profile monitoring is needed in therapy with which drugs? Answer is lepidolin, which is a direct thrombin inhibitor, and it requires APTT monitoring because of the bleeding risk. So all the these kind of drugs, the fondaparinux, the direct thrombin inhibitors, the all these categories are very, very, very important. Please learn about the differences between all of them. And yeah, and which of them are directly acting, all that are also very, very important. Please go through them in detail. Next, which of the following antihypertensives are not used in pregnancy? Answer is propranolol, which is a non-selective beta blocker, is avoided in pregnancy because of the fetal growth restriction. So safer ones are methyl-dopa, hydralazine and labetalol. Next question, which of the following atypical antipsychotics has the highest risk of galactoria? Answer is risperidone. It has high D2 receptor blockade in the pituitary, increasing the prolactin secretion, leading to galactoria. Next question, when the pH is equal to pK of a drug, which of the following statement is true? This is again important from biochem view as well, but yeah. So here the answer is concentration of the drug is 50% ionic and 50% non-ionic. So pKa is the pH at which a drug is 50% ionized and 50% unionized. So please know about pH, pK, when will be equal, all those very, very important, when will precipitation happen, all these things like the basics, please learn about them. Next, corticosteroid indicated for the stimulation of fetal lung maturation in preterm labor is answer betamethasone and dexamethasone. They cross the placenta effectively to induce the surfactant production. And they're given as 2 doses. Betamethasone, it is given as 2 doses, 12 mg each, 24 hours apart. If it is dexamethasone, then it will be given in 4 doses. Next, what is the site of action of amphotericin B? And the dosage is also different. It will be 6 mg in case of dexa. So please learn about all that. Next, what is the site of action of amphotericin B in fungi? Answer is cell membrane. So amphotericin B binds the ergosterol in the fungal cell membrane, forming pores that leak ions. Next, which of the following acts by causing both decreased bone resorption and increased bone formation? Answer is strontium renylate. Has dual action, that is, it decreases the resorption and increases the formation. Next, what is the drug used for refractory intractable rheumatic chorea? Answer is sodium valproate, which is preferred for refractory Sydenham's chorea due to fewer extrapyramidal side effects than dopamine antagonists like haloperidol. Next, what is basiliximab? Answer is interleukin-2 receptor antagonist. Basiliximab is an anti-CD25 monoclonal antibody which blocks the interleukin-2 receptors to prevent the T-cell activation in transplant rejection. Next question, which of the following condition can be treated with pyrazipine? Answer is peptic ulcer disease. Pyrazipine is an M1 selective anticholinergic which reduces the gastric acid secretion with minimal side effects. Next question, which of the following antimicrobial is effective against an organism producing extended spectrum beta-lactamase? Answer is piperazine tazobactam. So extended spectrum beta-lactamase producing bacteria, they resist the penicillins, cephalosporins and monobactams. So tazobactam inhibits the extended spectrum beta-lactamase, restoring its activity. And amoxiclav is less effective against ESBL. Next, which of the following inhibits the synthesis of glucocorticoids? Answer is metirapone. It reversibly inhibits the 11-beta hydroxylase, blocking the corticol synthesis. It is used in Cushing syndrome diagnosis. Next question, isosorbide dinitrate is indicated for congestive heart failure in combination with which vasodilators? Answer is hydralazine, because isosorbide dinitrate plus hydralazine, they reduce the mortality in heart failure with reduced ejection fraction, especially in the African Americans. Next, what is the mechanism of action of colchicine? Answer is it binds to tubulin and inhibits the granulocyte migration. So colchicine binds to tubulin and prevents the microtubule formation and neutrophil migration in gout. Next question, which of the following statement is true about prasugrel? Answer is it is a prodrug. So prasugrel is a prodrug activated by CYP3A4 or 2B6 and not by the CYP2C19. So all these, again, their activated by all these are very, very important. Please learn. All the actions are very, very important. Please learn about this, because nowadays questions are like tricky and questions can come from these areas. If you want to get into good ranks, yes, please go through them. Next, apixaban belongs to which of the following class of drugs? Answer is factor Xa inhibitor. So again, factor Xa inhibitor, direct thrombin inhibitor, the directly acting, all those indirectly, everything very, very important about these type of questions. Please learn. So apixaban is an oral direct factor Xa inhibitor like rivaroxaban, edoxaban, etc. Next, moving on to pharmacology 2019 questions. Calculate the therapeutic index of a drug whose drug response curves are plotted here. So according to this, the TD50 is 6 mg from the graph and ED50 is 2 mg from the graph. So therapeutic index is equal to TD50 by ED50. So that is equal to 6 by 2 and the answer becomes 3. This is the calculation. Please learn the formula. Next, which statement is true regarding the dose response curve shown? So here it is, we can see that B is a competitive antagonist because drug B causes a rightward shift indicating competitive antagonism. And they shift the competitive antagonist, they will shift the dose response curve to right. And also please learn how to identify the efficacy and potency. So if at all the more the left, it'll show that the potency of the drug. So here you can see the more left is A and then it becomes C and then it becomes B, and efficacy is upon the height. So efficacy is similar for A and B, but C has a lower efficacy. Next, which anti-glaucoma medication is unsafe in infants? Answer is brimonidine. It is an alpha-2 agonist which crosses the blood-brain barrier, risking the CNS depression and apnea in infants. Next, a drug with a very high volume of distribution, like around 6 liter per kilogram, is likely it will be sequestrated in the body tissues because high VD indicates there is extensive tissue sequestration. Next, which phase of clinical trial is called the efficacy trial? Answer is phase 2. So clinical trials, very, very important about their numbers, about what is being done, what type of study is being done, everything is important. Please learn about them. And the phase 3 is like when it comes into the market, and the post-marketing surveillance will be in the phase 4. All these are very, very important questions. Recently in the NEET also they had asked question about pharmacology regarding the phase. So every year, even in other exams like FMG and INICET also, they're focusing on these clinical trials, very important area. Next, which is an oral factor 10A inhibitor? As I've told, very important area is direct thrombin inhibitor, factor 10A inhibitor and all are very, very important. So answer is rivaroxaban. Next, drug of choice for diphtheria carrier state. Answer is erythromycin. So erythromycin for 7 days eradicates the Corynebacterium diphtheria carrier state. So other drugs are not much effective here. Mechanism of oseltamivir and zenamivir. Answer is neuraminidase inhibition. So these drugs, they inhibit viral neuraminidase, preventing viral release from the infected cells. Next, synthetic prostaglandin F2 alpha derivative used as an abortifacient is answer carbopros. So these are some direct questions. You just have to learn them because they are like kind of basic knowledgeable questions. Please learn. And drug activating potassium ATP channel is nicorandil. So nicorandil activates the potassium ATP channels, causing vasodilation. Also please learn about the mechanism of action of the features seen, cyclic AMP, cyclic GMP action, all these how do they act, like please learn about them, very, very important. Next, most effective antiemetic for chemotherapy-induced vomiting. Answer is granisetron, which is a 5-HT3 antagonist. It is a first line for chemotherapy-induced MSS. Next, true about teduglutide. Answer is it is a GLP-2 analog. Teduglutide treats the short bowel syndrome via mucosal growth stimulation. Next, what is cis atracurium? Why is cis atracurium preferred over atracurium? Answer is that there will be less histamine release because cis atracurium causes less histamine release, and so there will be reduced chances of hypertension or bronchospasm. Next, drug inhibiting neutrophil recruitment. Answer is colchicine. It inhibits the microtubule polymerization, so it reduces the neutrophil chemotaxis, and it is used in gout and familial Mediterranean fever. Next, fluoroquinolone maximum bioavailability is, answer is levofloxacin. So levofloxacin and ofloxacin, they have higher bioavailability. Oral and IV doses are equivalent. Next, mechanism of triazole. Answer is ergosterol synthesis inhibition. So triazoles, they inhibit the 14-alpha-sterol demethylase, blocking the ergosterol synthesis. Next, false about acitretin is answer avoid pregnancy for 6 months post-therapy because acitretin requires 3 years post-therapy contraception due to teratogenicity. The other thing, please don't get confused between acitretin and isotretin because isotretin requires only 1 month post-therapy contraception, whereas acitretin requires 3 years post-therapy contraception. Next, cilastatin prolongs the action of, answer is imipenem, because cilastatin inhibits the renal dehydropeptidase, preventing imipenem breakdown. Next, drug to differentiate myasthenia gravis from cholinergic crisis is, answer, edrophonium. It is a short-acting acetylcholine ACHE inhibitor, and it improves the weakness and myasthenia gravis, but it worsens the cholinergic. Next question, true about pegylated filgrastim. Answer is, it is contraindicated in sickle cell patients. So pegfilgrastim can trigger the sickle cell crisis. So that's why it shouldn't be, it should be always in a caution. Next, best treatment for chronic SIADH. Answer is tolvaptan, which is V2 receptor antagonist, which promotes the free water excretion. Next, IV mannitol is used in, answer, glaucoma. So all the anti-glaucoma drugs, please learn about them, and very, very important. Next, carbapenem with highest seizure risk is, answer, imipenem, which crosses the blood-brain barrier and causes seizures, especially in renal failure or CNS lesions. Next, maintains the ductus arteriosus patency is by prostaglandin E1, and example is the alprostadil, which keeps the ductus arteriosus open in duct-dependent congenital heart defects. Moving on to 2020 questions. Which of the following is an inhibitor of DNA synthesis? Answer is 6-mercaptopurine. It inhibits the DNA synthesis by being metabolized into 6-thioinosinic acid, which blocks the de novo purine synthesis. Next question, a patient on lithium therapy developed hypertension. He was started on thiazides, after which he developed lithium toxicity symptoms. What is the mechanism? Answer is, thiazides increase the tubular reabsorption of lithium. So thiazide cause sodium loss, triggering compensatory sodium reabsorption in the proximal tubule. Since lithium is handled similarly to sodium, its reabsorption also increases and reducing the excretion of it. Next, which drug should not be prescribed with theophylline? Answer is erythromycin, because erythromycin inhibits the CYP1A2, the enzyme metabolizing theophylline, leading to the toxicity of theophylline. Next, which drug gets deposited in cornea? Answer is chloroquine. It accumulates in cornea, causing keratopathy and corneal opacity. So these are some direct questions. Please learn them. That is why you can't miss out on a PYQ, even if it's a direct question, a direct PYQ, and if you haven't seen them before, and if it comes in the exam and you're making it wrong, then it's going to be a major flow from your side, because everybody else will be making it correct. And if you make a PYQ wrong, it's like it's gonna impact your rank a lot badly. And PYT is also very, very important, because that is the area from which every time questions are repeatedly coming. So if you want a good rank, if you want a good seat, then PYTs are very, very important. Next, which drug treats antipsychotic induced Parkinsonism? Answer is trihexyphenidyl. So drug induced Parkinsonism results from D2 receptor blockade causing cholinergic excess. Trihexyphenidyl, which is a central anticholinergic, restores the balance. Next, which antiarrhythmic is contraindicated in interstitial lung disease? Answer is amiodarone. It causes pulmonary fibrosis, worsening the interstitial lung disease. Next, which drug inhibits the late sodium current in the heart? Answer is ranolazine, which inhibits the late sodium current, reducing the intracellular calcium and the diastolic tension. Next question, which drug is safe for urinary retention in a diabetic COPD patient? Answer is tamsulosin, which is an alpha-1A blocker, and it relieves the retention without bronchoconstriction. The other options like betanicol, it is contraindicated in COPD because of the muscarinic-induced bronchospasm. Next, which drug treats motion sickness? Answer is promethazine. So please learn about the other drugs also which are used in motion sickness. Next question, what is the first line treatment for postmenopausal osteoporosis? So first line treatment for postmenopausal osteoporosis, it is always bisphosphonates. Very, very important, guys. Learn about the examples of bisphosphonates. And bisphosphonates, they inhibit the osteoclast, reducing the bone resorption. Next question, how does beta-lactamase confer antibiotic resistance? Answer is, it degrades antibiotics. So beta-lactamase hydrolyze the beta-lactam ring, inactivating antibiotics like penicillins. Next question, a patient with ADPKD prescribed tolvaptan presented with dry mouth and increased thirst. What is the likely cause? Answer is increased free water clearance. So tolvaptan is a V2 receptor antagonist, reducing the aquaporin 2 insertion in renal tubules. This increases the free water clearance, causing dehydration. Next question, a female patient is on first-line pharmacological therapy for bipolar disorder for 6 months. She is fasting for few days due to religious reasons and then presents with seizures, cause tremors, confusion and weakness of limbs. Which of the following investigation should be done to help diagnose her condition? Answer is serum lithium level, because lithium is a first-line mood stabilizer for bipolar disorder with a narrow therapeutic index, that is between 0.8 to 1.2 milliequivalents per liter. So fasting or dehydration increases the sodium reabsorption, leading to concurrent lithium retention and leading to toxicity. And the symptoms of severe lithium intoxication will be seen when the levels are more than 3.5. And serum lithium level is the definitive test which is done for diagnosing the condition. Next, pegloticase is used in the management of, answer is chronic gout. And the management of gout, again a very important question. Management of gout is it's very important. Management of rheumatoid arthritis, all these are very important, the drugs in all those cases. Next, which of the following is an inhibitor of RNA synthesis? So answer is rifampicin. Rifampicin binds the RNA polymerase, that is RPOB subunit and of it, and causes blocking of the RNA chain formation. The mechanism of other drugs are also given here. Please go through the mechanism of action of drugs is very important. Because which of the following fluoroquinolone is not given in liver disease? Answer is perfloxacin, because perfloxacin, it undergoes hepatic metabolism and so it is contraindicated in liver disease. Next, theophylline causes diuresis by, again a previous year topic, previous year question as well. So answer is adenosine antagonism. Next question, graph below shows the relationship between the log dose and the response of 3 drugs ABC, which has highest potency. Again a PYT actually, it is a related question. I've explained about this in one of the previous questions. So here the answer is A, because that is the one which is most left. And efficacy will be depending upon the height. Next, a patient presented with biliary colic. The intern administered an analgesic, following which the pain got aggravated. Which of the following could be responsible? Answer is morphine, because morphine causes sphincter of Oddi constriction, leading to biliary pressure and worsening pain. Pethidine is the one which is preferred in biliary colic. So that's it guys for this video, and the next 2 years I'll be doing in my next video. The other 3 years I'll be doing up in my next video. Till I come back with my new video, stay tuned. Till then, bye.